Okay, let's see about clamps used in the neurosurgery. So identify this clamp. So this is your normal Alice tissue clamp. Okay, the alternate name is clamps with teeth and tissue clamp. Okay, the purpose is the use of this clamp is used in securing or lifting, holding masses or tissues designed for resection. Okay, when it is to resect a tissue, it is to hold the mass or lift. Example: spinal lipoma or large intracranial meningioma or fat grafts can be able to hold. Okay, and lift. Okay, so that we can dissect it easily. Okay, so the interlocking teeth reduces tissue injury. Okay, and it's also used for securing cords, cables, suction tubing to the surgical drapes. It has many varieties based upon the number of teeth. This may be curved or straight or come in varying of lengths. Okay, so let's identify this clamp. Okay, so this is your classic clamp. Okay, so otherwise called Cradle clamp. Okay, or Lahey's clamp or Halstead clamp. Okay, or Adson clamp. Okay, many names are there, but it is a routine classic clamp. Okay, and it is also called as a hemostat. Okay, or abduced clamp, mixture clamp. Okay, and snap. Okay, the main use of this clamp is occluding the vessels or delicate tissues. Okay, it can also used to dissect the tissue planes. Okay, tissue plates. Okay, and used to commonly to grasp or occlude the vessels, and it may be used to pass a suture tie around the occluded vessels. Okay, also used to secure items to the surgical drapes. Simply, we in our routine practice, we call it a curved artery forceps. Okay, so this is the name is classic clamp. Okay, it can vary with the straight, curved, or angled form. So identify this instrument. I use clamp. This is your Cradle clamp. Okay, so the uses are similar to that what you have seen before. Okay, so this is the most usually commonly used clamp. Okay, it's Cradle clamp. Okay, so it is to clamp or occlude the vessels, delicate tissues, are used to dissect the tissue planes, are commonly used to grasp or occlude the vessels, also can be used to secure items to the surgical drapes. Okay, so you can occlude the vessels, you can connect it to the drapes. Okay, it has many varieties like straight, curved, angled. It's available in various variable lengths. So next identify these clamps. So this is where Foster sponge stick. Okay, so is called a sponge stick. Okay, or ringed forceps. Okay, so this main purpose of this forceps is good for grasping or holding the tissues. Number one, it most commonly used with the 4x4 mounted. Okay, and used for surgical preparation or prepping. Okay, while draping, you can hold the gauze piece. Okay, by using this Foster sponge stick, and we can easily drape that area. Okay, and blunt dissection and improving visualization by soaking of blood in large wounds. Okay, so it can be available in various straight curved forms. Okay, smooth or serrated edges. Okay, identify this forceps. This is where Halstead mosquito clamp. Okay, also called as clamp or mosquito or Halstead, Hartmann, hemostat, mini snap or snap. Many names are there. The purpose is mainly clamping or occlude the vessels. Okay, or delicate tissues. It can also be secured items to the surgical drape or hold sutured tissues or for a retraction. Example, dura. Okay. So we have after reaching the dura, especially in case of spine surgeries, we can give a tie on the dura and we can retract the dura using this mosquito sources. Okay, it can be many varieties are available based upon the straight or curved. Okay. Next to the forceps, this is a Kelly's clamp. Okay, this is a clamp, Cradle clamp, or Ronstadt clamp, or pin clamp. Okay, or hemostat, simply called as hemostat. Okay, this is also most commonly used clamp. Okay, it is used to the uses are similar to that of the previous clamps. Okay, it is used to clamp or occlude the vessels or delicate tissues, or used to dissect the tissue planes. Okay, and it's grab or occlude the vessels. Okay, and it's used to secure items to the surgical drape. Okay, and identify this instrument. So this is your Cocker's clamp. Okay, the alternate name is clamp and Ostner clamp and a roster clamp. Okay, Rostner Ochner's clamp, clamp with the teeth or bone clamp. Okay. So is mainly useful in securing, lifting or holding masses or tissues designed for resection. Example, spinal lipomas, large intracranial meningiomas, fat for fat graft, fascia for approximation. Okay, it's called Cocker's clamp, and it's also used for stabilizing bone fragments. Okay, so example, fibula for graft molding. Okay, so we can or iliac bone graft. Okay, iliac bone graft, when you are taking iliac bone graft while using in the case of anterior cervical discectomy and fusion procedure, for the fusion purpose we can keep the iliac bone graft in the space of the disc. Okay, to hold that bony particles we can use this Cocker clamp. Okay, so it having a very tipped point. Okay, these are a tipped point. Okay, and it has many varieties of straight or curved jaws. Okay, and available in variable lengths. Okay, next, identify this clamp. Okay, this is your straight Halstead mosquito clamp. Okay, simply called straight mosquitoes. Okay, clamp, otherwise called clamp mosquito, Halstead, Hartmann, hemostat, mini snap. Okay, it is also same purpose is to often used to occlude or clamp the vessels or delicate tissues. It can also be used to secure items to the surgical drapes. Okay, or hold suture tissue for retraction. Example, dura. So identify this clamp. This is towel clamp. Okay, otherwise called Backhouse clamp, Edna clamp, Jones clamp, Pierce towel clamp. Okay, simply called as a towel clamp. Okay, so is used for securing items to the surgical drapes and grasping the thick tissues, tumor or bone for the retraction or counter traction. Okay, so we can secure items to the surgical drapes, grasp thick tissue, tumors or bones, retraction and counter traction. Okay, it has many varieties like perforating, non-perforating. Okay, it has sharp and blunt edges. Okay, and variable lengths. Okay, and hinge or spring self-retaining mechanism also are available. Okay, whether it is we have used the hinged or spring self-retaining. Okay, we'll see later. So now we revise the clamps. This is our towel clamp, and this is our straight Halstead mosquito clamp. Okay, and this is our Cocker's clamp. This is Kelly's clamp. Okay, mosquito Halstead mosquito clamp. This is your Foster sponge stick. Okay, so Cradle's clamp, or classic clamp. So these clamps are mainly based upon the curvatures. Okay, curvatures in the lengths. It can called as a various clamps. Okay. Let's go to the retractors. This is a retractors. This is a retractor. What is the name of this retractor? This is the Army Navy retractor. Okay, the alternate name is US. They can simply call as US or Army. Okay, so US Army or a Navy retractor. The purpose is maintaining retraction in the small wounds. Okay, alternatively, these retractors can be used to push tissues out of the way as well. Okay, good for anterior fat harvest. Okay, especially in the initial parts of minimally invasive surgery. Okay, MIS and posterior lateral cases. Okay, and functional implant cases. Okay, it is very useful in the case of anterior fat harvest, initial parts of minimally invasive spine surgeries, especially via the posterior and lateral way, and is good for the implanting the functional implant cases. So identify this retractor. So it has a space for the surgeons to work up. It's called Cushing's retractor, and it has curved tissue retractor and Cushing nerve retractor and curved Cushing retractor. Okay, many names are there. Okay, so the purpose is retraction of the skin or muscle flap, especially during craniotomies. Next is also used when making burr holes for protection from surrounding tissue inference by pushing tissues away and placing the drill bit within the curve of the instrument tip. Okay, we can also use the drill in between the tip of the instruments. Okay, it has a working space for the surgeons to do the procedures. Okay, and we can also ligate the vessels in between. After retracting the tissues, we can ligate the tissues in between also. Okay, this is called Cushing's retractor, and this is another retractor. Its name is fish hook with stronger cables. Okay, fish hooks with stronger cables, otherwise called fish hooks, flap hooks, dural fish hooks, and stronger hooks. Many names are there. Okay. So its main purpose is the retraction of the skin, muscle and the dural flaps. The hook attaches to the cable. Okay. Whether it is maybe attached to the spring or not, which are secured to the drapes. Okay. So this is your hook. Okay. That attached to the spring. This is your spring. Okay. So this we can fix it with the, hold it with the drapes. Okay. So it's having minimal traumatic retraction system for craniotomy flaps. Okay. So sharp, it based upon the sharp or dull hooks, it can be varied or springed or not. Whereas single or double hooks, it also can be varied. Okay. Next, identify this instrument. This instrument is, the retractor is called, Galpy retractor. Okay. It's also called angled Galpy or short Galpy. The purpose of this retractor is used for retraction of the surface tissues to allow improved visualization of the surrounding area. Okay, it has sharp ends, provide a point retraction of the wound, and is used throughout the neurological surgical procedure for superficial and deep tissue retractions. Okay. So mainly for the tissue retractions, it has curved and angled ends, varies. Okay, according to the length, whether it is locking present or not, it varies. It's called Galpy retractor. Identify this instrument. This is also a common use in neurosurgery. This is called Joseph skin hooks. Okay. It is called cotton skin hook or gilly skin hook. Okay, or freer skin hook, or skin, simply called as skin hook or single hook. The purpose of this skin hook is retraction of the skin and sometimes also muscles for increasing wound exposure. Okay, it is also useful for holding pericranium during harvesting or for holding up skin flaps. Okay, based upon the sharp or blunt, it can be varied. Okay, this is your Joseph skin hooks. Next, identify this instrument. This is your Joseph skin hooks with the 2 prongs. Okay, the alternative names is blunt Joseph hooks, blunt Cotal double hook, skin hook. Okay, this is also having the similar purpose with the, what is the Joseph skin hooks. Okay, but here the edges are blunt. Okay, identify the hook. This is your Joseph skin hooks with the 2. Okay, Joseph skin, 2 hooks are present here. This is a prong, 2 hook, prongs sharp. Okay, the previous one was blunt. Here is it was sharp. This otherwise called Joseph hook, Guthrie hook. Okay, skin hook. Okay, this is mainly for the retraction of the skin or muscles for increasing wound exposure. It is also useful for holding the pericranium during harvesting or holding up the skin flaps. Okay, while holding the pericranium or skin flaps. Okay, in Joseph skin hooks only you have seen 3 types. One is a normal Joseph skin hook. Okay, with having a single hook only. Okay, another is a double hook prong which is blunt, and this double hook with the sharp prong. Okay, this other look like a very Galpy retractor, but its length is very long. So this other is called long Galpy retractor. Okay, long Galpy retractor is angled Galpy or short, otherwise also called short Galpy. It's used for retraction of the surface tissues to allow for improved visualization. Okay, and it has sharp end, provides a point retraction of wound, used throughout the neurological procedure for superficial deep tissue retraction. And this is another important retractor used in the neurosurgery day-to-day life. It's called malleable brain retractor. Okay, it is available in various sizes and various lengths. Okay, depends upon the depth of the brain materials we want to retract. Okay, it's called malleable brain retractor. Okay, otherwise called malleable retractor, brain ribbon or brain retractor. Okay, this has a flexible handheld. Okay, we can flex it. Okay, or mountable brain retractor. It can be used for custom retraction angles. It can be available in various widths, shapes and materials. Identifies retractor, so called mastoid retractor. Okay, the alternate names is Janssen mastoid, okay, Wheatlander Mollison, Wheatlander and Somme Wheatlander and mastoid. Simply called as a mastoid retractor. Okay, as we all know, this mastoid retractor is commonly used to retract the tissues, and this is having a self-retaining, okay, self-retaining retraction system for skin and soft tissues. You can also use it for any small skin incision, percutaneous screw placement, and any other procedure utilizing only small incisions. Okay, and it based upon the sharp, curved, or angled arms, it can be varied, and based upon the teeth also, sharp or blunt teeth also it can be varied, and single or multi-toothed jaws. Identify this retractor. It is Mosquito retractor. Okay, it also simply looks like a master retractor, but the curvature is different. Okay, and the length is different. It's also called Mosquito retractor. Okay, and also called Erico Adson. Okay, or Mollison, or curved weight liner, or curved cerebellar. Okay, it's also called, simply called as curved cerebellar. Okay, that means it's a self-retaining retraction of skin and soft tissues, especially larger and deeper wounds, particularly in the supine and posterior fossa cases. Whenever you are doing posterior fossa craniectomy, okay, suboccipital craniectomy, okay, for many purposes, or posterior fossa ECH, okay, for posterior fossa decompression, craniectomies, that for the purpose we can use this Mosquito retractor, okay, to retract the skin and soft tissues. Next, this retractor you see, for the one edge having serrated edges, the another is a blunt type. One is serrated, another is a blunt type. So it's called a Sen retractor. Sen retractor. The alternate name is Miller Sen skin rake retractor. It having a double-ended instrument for retraction of the skin and muscles for increasing wound exposure, and useful for holding the pericranium. It's also good for retracting small amount of tissues in confined spaces. It has sharp or blunt teeth. Okay, Sen retractor. Identify this retractor, which having the locking system. Okay, this is your small tooth retractor, otherwise called Heath retractor. Heath retractor, also called wound spreader or small skin retractor. The use of this retractor is useful for retraction of small openings in the skin. Okay, useful to small openings in the skin, and is useful for any burr holes or percutaneous screw placement, and any other procedure utilizing only small incision. It also available in single or multi-toothed jaws. Any of the instruments looks like a mastoid, but it's you see here it's having 4 toothed series, only the opposite side only having 3. It also have interlocking systems. It is a weight liner. Okay, weight liner. Okay, it is a self-retaining, similar like that only, self-retaining retraction of the skin and soft tissues. One of the most common retractors in the neurosurgery. Okay, weight liner retractor. Okay, we can also use it for the cerebellar, call it as a cerebellar or curved cerebellar, especially useful in the posterior fossa surgeries to retract the skin and the soft tissues in the posterior fossa. We will revise the retractors. This is our weight liner retractor, and this is a small tooth retractor, and a Sen retractor. This is our Mosquito retractor. This is our mastoid retractor. This is our malleable brain retractor. This is our long Galpy. Okay, and this is our Joseph skin hook with the 2 sharp prongs. So it is a long Galpy retractor with the blunt. This is our Joseph skin hook. Okay, it is our rotating Galpy retractor. So fish hook with the stronger cables. So Cushing retractor, and this is our Army Navy retractor. This is about the dissectors. So various dissectors that we will use in the neurosurgery. So dissectors. So this is our Penfield. Penfield number 1, otherwise called large pancake dissector. Okay, it is a double-ended instrument for dissecting, scraping, or separating soft tissues from the bone. Okay, so it having nasal septum, skull base, or dura, etc. Even as a protective device when drilling. Okay, so the blunt edge here, the blunt edge is smaller. Okay, the blunt edge is very smaller. Okay, and less curved. Then here the blunt edge is less curved than the blunt edge is smaller and less curved than the Penfield 2. Okay, but it still can be used to separate a bone from the dura. Okay, so we can use this. Okay, we can use this edge, a blunt edge, and we can use to separate bone from the dura. Okay, but it is less curved. Okay, the curvature of this is very less. This curvature is very less the Penfield 2. The Penfield 2 is still more curver. The Pen 3 is more curver, and the Pen 4 is more curver. Okay, to separate the we use this part to separate the delicate structures. Okay, adhesion with the dura or dura of the pericranium. Okay, bone from the dura. This is Penfield number 1, and this another variant of the Penfield one, which has the curvature is more. You see, the curvature is comparatively more than the Penfield one. This other is called Penfield 2. The 2 dissector. This is also called double-ended instrument for dissecting, scraping, and separating soft tissues. Okay, soft tissues from bone, nasal septum, skull base, or dura, etc. Is also even as a protection device. Very important protection device when drilling or placing bone wax for hemostasis in the narrow spaces. Okay, the blunt end is less curved than the Penfield 3, but still can be used to separate bone from the dura. Okay, so its main action is it can be also used as a protection device. When we are going for a drill, if you want to protect the vital structures, we can use this Penfield, and we can drill on one side. Okay, so that the drilling sharp edges will not come into contact with the vital structures. Okay, so we can use this Penfield for the separating the vital structures. Okay, and it can be also used to separate bone from the dura. So this is another variant of the Penfield where the curvature is little bit more than the Penfield 2. It's called Penfield 3. Okay, these are also double-ended instruments, the same uses compared to the Penfield. Okay, it is also used as a protection device. Okay, and the curved end is most often used to separate bone from dura through burr holes. Okay, this is the curved is most often is used to separate it. This is the one which will mostly used to separate the dura from the burr holes. This is another variant of the Penfield where you see it has the another end. Okay, is very different. Okay, and it has a blunt end which is more curved. Okay, it's more curved. Okay, you can notice here it's more curved. It's called 4 dissector. Okay, it is a same uses like other Penfield. It is also used for dissecting, scraping. Okay, and a frequent use in separating soft tissue from the bone. Okay, and you can also use it as for the protection, and you can apply bone wax for hemostasis in the narrow spaces. Main is also used for deepening the corticotomy incision. Okay, you can use this for deepening corticotomy incision, the exploration of intraparenchymal hematoma. Okay, so for this purpose we can use this Penfield 4. So the back of the candle can be used to place bone wax in particular areas. Okay, we can place the bone wax here. Okay, a bone wax, and you can apply in the certain important areas like screw holes, bleeding bone edges for hemostasis. It's Penfield 4. This is what Penfield 4. Okay, so you have to see the other part of the edges is look like a tip of the pen. Okay, tip like a back side of the pen. Okay, that's Penfield 4. It's a Penfield 3. The curvature is more. The Penfield 2. The curvature is lesser than the Penfield 2, and this is a Penfield 1. Okay, the Penfield 1 which is having the opposite side is different. Okay, the elevators, identify this elevator. So this is called your bolus elevator. The other name is also called periosteal elevator. We can call it as simply called as a periosteal elevator. The purpose is scraping tissue of the fascia and bone. Example, periosteum, and it can also be used to retract and protect soft tissues when drilling through the bone. Okay, suppose you are taking dural tack-up sutures during craniotomy. Okay, so it can be used to protect the soft tissues when drilling through the bone. Okay, so that we can retract the soft tissues and your bone will be visible well. So we can drill drill through the bone very easily. Can be available in various sharp or blunt edges and narrow and wide ends, okay, curved or straight. So identify this instrument. So this is called your Cotal Cranny elevator. Okay, Cotal Cranny elevator. The alternate name is periosteal. You can also call it as a Cobb elevator. Cobb. Okay. Okay. So it's also used to scraping the tissues, in particular periosteum and dura of bone. It can also used to retract or protect soft tissues while drilling through the bone. It can also be available in various sharp or blunt or narrow wide ends. So this is another instrument. The name is Cotal elevator. Simple Cotal elevator is also called the septal elevator or mucosal elevator. Okay. So double-ended instrument is sharp or flat end and the other with the teardrop shape, allowing the dissection of delicate soft tissues of most commonly the septum. Okay. While you are going to the transnasal transpinal approach for the pituitary surgery, we can remove the soft tissues from the nasal septum by using this Cotal elevator. Okay, otherwise called septal elevator. It is also used in cranial surgeries to separate the dura, ligament, or other soft tissues from the bone. Another elevator name is Lagenbeck elevator. Lagenbeck elevator, others also called periosteal, Cartil, Cranny, Candler, Cobb elevator. The purpose is very useful in scraping tissues of fascia and bone, also to retract protect the soft tissues, exceptionally taking a dural tack-up switches during craniotomy. Lagenbeck elevator. So this is a Lagenbeck elevator. Let's revise elevators. This is your Lagenbeck elevator. Okay, this is your Cotal elevator. You have two narrow ends. Okay, this is a Cotal Cranny elevator. This is a Bowley's elevator.